Thank you all for being here this afternoon. We're very excited to share a little bit more about our services and our resources with you all today. So, Kate, as Gail mentioned, my name is Padma Enswa. I use she, her pronouns. I'm the Director of Wellbeing and Health Promotion in Alice. And so I do a lot of our community well-being work. Just a little bit about me. I've been at Columbia for 9 years now. So I've really enjoyed my time here and have stayed for a while. What really brought me to this work is just a love of working with college students. Students are at such a transitional age, learning and growing and exploring for themselves. And so just being able to help them through that process has been a really rewarding experience. So what we're going to be talking about today. So we're going to cover a lot of information, including what our department does and how we support students, what well-being is, and how you can prioritize it while you're at Columbia. And then thinking about what strategies you can use to feel a sense of belonging here, because we know that sense of belonging is really important and tied to well-being. And then, of course, we will talk about how Atlas Health Promotion can support you and how you all can connect with our services. So who are we? So Alice Health Promotion, we're a health promotion unit where we work to create and sustain a healthy university community in which students can achieve their personal and academic goals. So in order to do that work, we have a great team that I work with, and our team is made up of health promotion professionals with various backgrounds coming from public health, student affairs, counseling, substance use and recovery, sexual and reproductive health, and wellness coaching. So really, we have a range of experience and folks who can support our students. So what exactly, or in what ways does Alice support you all? So we really consider ourselves a low barrier service for students. So we want to work with the students to learn about and work towards or navigate resources related to their well-being. So we work with students in a number of ways. So we are confidential. So we do a lot of one-on-one meetings with students to provide services around sexual and reproductive health, gender-affirming care, substance use and recovery, wellness coaching, resource navigation, and health education, which I'll talk about all of those a little bit more in depth later on. We also do a lot of work partnering with other departments around campus. So much of our work is tied to well-being, and in order to do that well-being work, we can't do it in isolation. So we work with a lot of our other departments on campus to really understand the ways, understand students' well-being needs and ways to address those needs, whether that be resources, processes, different systems. And then we also work on different initiatives that support student well-being across the Columbia community, such as health literacy and Go Ask Alice, which again, we'll talk more about later. In addition, we work on large-scale and policy initiatives, such as monitoring and supporting students with different infectious diseases. So thinking about like COVID, chickenpox, mpox, among others, we know that when it's kind of emerging in society and in the community, sometimes it can come to our campus, and so supporting students with that. And through all of this, we're working, or particularly with those infectious diseases, we're working to ensure that there are resources and structures in place to support those students who are isolating due to those illnesses. Okay, so moving along to well-being. So we're going to talk a little bit about what well-being is and how you all can prioritize it while you're a student here. So what is well-being at Columbia? At Columbia, we use the World Health Organization definition of well-being. What you'll see in the field, if you're interested, is there are a few different definitions. We very intentionally chose the World Health Organization. And this definition states that well-being is a positive state experienced by individuals and society. It's a resource for daily life, and it's determined by social and environmental conditions. A society's well-being can be observed by the extent to which they are resilient, build capacity for action, and are prepared to transcend challenges. So this is not to say that well-being So all this is to say that well-being goes beyond the individual and really factors in the social and cultural context and the environment that someone is in. So we're not looking at it just in isolation of the individual. And it's also not just about being healthy. It's about having that resilience and the ability to navigate different challenges in life and get through that. All right, so how can you all prioritize your well-being at Columbia? So, health and well-being are important to your academic and personal success. And so we want to make sure that how you take care of and prioritize your well-being is prioritized because we want you all to be able to make the most of your Columbia experience. And so we also want to acknowledge that well-being looks different for everyone, and there's no one-size-fits-all solution. Uh, a lot of it is thinking about like what works for you. Um, and so one of the ways that we encourage students to do that is to think about what's important to you. Understanding your goals and how you want to experience Columbia can help clarify how you want to spend your time and energy. So thinking about how you can reflect on what's important and about your well-being and what well-being means to you and looks like for you can really help you live your life in alignment with those values and the things that you care about. So some examples might include, you value having time for friends and loved ones because it helps you manage your stress. So, if you have some free time on your hands, instead of signing up for another campus activity because you see that gap in your schedule, maybe leaving that time and space in your calendars for that time to prioritize and connect with those people who you care about. And so that would be a way of, aligning with your values and also prioritizing your well-being. Um, so if you aren't really sure where to go or how to get started, you can always come visit us in Alice, and we'll talk about those types of the ways in which you can do that. So thinking about well-being a little bit more and how you can engage with it, you can do that by ensuring that your experience on campus includes not just academics, but also thinking about your personal goals. So think about, are there clubs on campus that you're interested in? Um, are there ways that you might want to build a more sustainable physical activity routine? Even if that means doing different activities in your residence hall, getting your body moving in that way. Making some time for reflection, whether that's meditation, deep breathing, etc. Exploring the city, whether that's different sights, sounds, experiences, opportunities, both on campus and in the city. Uh, Being around and connecting with nature has been shown in research as a way to engage in with your well-being. So that can look like taking a walk around campus. And a lot of us are on our phones when we're walking, so maybe taking a moment to look up and look at the surrounding area. That could be a way of engaging with nature. You can also think about how you want to make time for hobbies, whether that's something that you had before and you want to explore again or something new. And then, of course, seeking out resources if you're feeling overwhelmed or not your best. All right. So thinking about that sense of belonging and connection, we know that that sense of connection and belonging can support your mental health, academics, and overall life satisfaction. So a way to identify which strategies to use to consider, what do you want to get out of your time here at Columbia? And what does it mean to you to be here? Something to note is that when you're reflecting on these questions, there's no right or wrong answers. It's really about what works for you and keeping that in the front of your mind. So that way you can, again, prioritize that and make sure that it's aligning with how you're engaging with the different opportunities at Columbia. So can you build a community at Columbia? That's always, it can sometimes feel daunting at times. So one way to do it is have some one-on-one interactions, building relationships with your peers. So whether that's people in your floor, people that you're in classes with, faculty, staff, all building those relationships with any of these folks can support your thriving and flourishing at Columbia. You can choose to get involved. There are hundreds of clubs and organizations and affinity groups across campus. And you can think about what are ones that align with what you want to get out of your Columbia experience and look into how to join. You can attend events. There's always events happening on campus, both in person and virtually. And so you can be on the lookout for what's happening, attend those that you might find interesting or find most interesting. And what you might find is that at those events, you might end up meeting other people who have similar interests, and that can be something that you connect on. And so these are just limited to those on campus, but if you're looking to build community outside of Columbia, there's also so much that the city has to offer. Okay, so looking more specifically about how Alice can support you in these endeavors to support your well-being and find a sense of belonging. Alice has a lot of different services. that we offer. So whether you're a new student or returning, college can be challenging, not just academically, but also mentally, emotionally, socially. So if you or someone you know needs support, there are both individual and community level services that we offer to Columbia students. So first focusing a little bit more on those individual services, like I mentioned, our services are low barrier. They are also offered both in person and virtually. So any student can access us. You don't have to be on site all the time, or you don't have to come into the office. The other piece that I just want to mention is that you don't have to be on the student health insurance plan to access our services either. So diving a little deeper into each of these services. So our health promotion appointments, they're really intended for if you know that you need help with a health and well-being related topic, but aren't really sure where to go, you can always schedule a health promotion appointment. So during these appointments, you'll meet with a health promotion specialist who can help you navigate both those on and off-campus services, really based on what those specific needs are for you. And so having that one-on-one support can be helpful. Health education visits. So if you have a health and well-being related concern that you're hoping to learn a little bit more about, you can drop in for a health education appointment. And so we have team members who can help you get the information that you need or direct you to reputable resources. We also offer individual and group wellness coaching. So if you have a health and well-being goal, but need some support with figuring out how to actually go about achieving it, you can meet with a wellness coach. So they are certified or nationally certified, and they will help you work through some of those action steps that can then get you towards that health and well-being goal. The other nice thing about wellness coaching is that there's no limit to the number of times you can meet with a wellness coach. So if you are a first year or just starting a graduate program, you can make an appointment in the next couple of weeks and then meet with a wellness coach at an interval that makes sense for you throughout your time here at Columbia. There's no limit. We also do substance use and recovery visits. So if you have a more topic-specific concern, such as your relationship with alcohol and marijuana, you can actually complete the alcohol or cannabis self-assessment online. So we can definitely share those out, or that you can access them via the Columbia Health website. And so based on your responses to those assessments, you can make an appointment with a basics provider. We'll talk with you about your goals related to the substance use and think through strategies that you might be able to use. And so along with our substance use and recovery visits, obviously we mentioned alcohol and cannabis, but we also offer nicotine cessation visits for students who either want to quit their tobacco or their nicotine use. Next one is sexual and reproductive health visits. So if you're hoping to get support around your sexual and reproductive health, so this can include HIV or STI testing, birth control options, pre-exposure prophylaxis or PrEP access, gender-affirming care, or medication abortion, among others. You can always come by our sexual and reproductive health drop-ins, which are offered both virtually and in person, and you can find those on our same-day service page. We also offer a well-being course for our Columbia College and School of Engineering and Applied Science undergraduate students. So this is really for those looking for their long-term well-being skill development. Students in these two schools can sign up for the well-being and student experience course through physical education. And so in this course, students will learn about a range of health topics, such as or well-being topics, such as connecting with nature, health literacy, navigating health insurance, financial literacy, among a number of other topics. And so have that time to learn about them, but also apply those skills that they're learning. And then the final individual service that we wanted to highlight today is Go Ask Alice. So Go Ask Alice is actually 30 years old. It's it's the oldest health Q&A website on the internet, but it's an anonymous health question and answer website that we oversee in our office. We have over 1,000 questions on the website and are adding more each week. And so we've recently redesigned the website to better meet students' needs, but it can be a really great resource if you have a health related question, but you're like, I'm don't want to just Google it because I'm going to get all this information, you can always check out Go Ask Alice first. All right, so moving on to some of our community level services. So if you are looking to get more involved in supporting student well-being on campus, there are plenty of ways to do so. We offer a variety of workshops and trainings. So Alice, we on a variety of topics, sorry. So you can choose to attend an open one that we offer monthly. But if you're also part of a group on campus, you can request one that's specific to that group. And again, these can be requested for in-person or virtual. And if there's a topic that you're interested in and there's a particular reason why that topic is particularly applicable to your group, we can talk about it and see if we can tailor it a little bit to your group's experience. We also offer a friend-to-friend training. This is one of our workshops and trainings, but I wanted to highlight it because it's longer, but it provides students with the knowledge and skills to recognize the peer who needs that additional support, and really focusing on strategies to get them connected to campus resources. So really learning how to build that community of care in terms of supporting those around you. We also offer naloxone and fentanyl test strips and trainings around those. So for students who learn how to, or we offer trainings for students to learn how to use naloxone and fentanyl test strips. And then once they complete that training, they can choose to carry the kits if they want to. And the idea there is that by carrying the kits, they can help reduce opioid overdoses on campus and in the local community. We also do dog therapy. This is a favorite event of ours for both us and for students. So if you or a friend or dog lovers and would benefit for some of that puppy love, you can look out for dog therapy events happening on campus. If you're a part of a student group, you can feel free to reach out to us about scheduling an event. We do them by request and take requests just before the start of the semester, and then kind of map them out for the request for the semester. With that being said, we can only do a limited number of events each semester, so definitely be on the lookout for those with different groups that you're connected with, or if you're interested, definitely reach out to us. And then lastly, we have a lot of opportunities to get involved. We have a number of volunteer positions and opportunities for you all to support fellow students and also receive some nationally recognized certifications and professional experience. So what that looks like is our CUL Peer Leader Program offers a certified peer education certification. So that's really going out into the community, doing some outreach, but also some workshops and trainings. And then we also have our wellness coaches. So again, nationally certified. They provide wellness coaching for our students. And then we also have a bunch of our GHAP advocates who do a lot of our sexual and reproductive health appointments with students. So a lot of opportunities to get involved with our work. And again, all of those opportunities are listed on the Columbia Health website. So you've heard about all of our great resources. So how do you get connected to us? You can always visit us at outreach events. So we are our CUL peer leaders table in Learner Hall every other Friday. So drop by to ask any questions or learn a little bit more about our services. But if you're looking for more immediate support, you can also access our website for drop-in hours. And that's the QR code that's listed there. It will list when our drop-in hours are, where you can reach us, and for what services. And then if you're not able to make our drop-in hours, you can also schedule an appointment. To schedule an appointment, you can complete the intake form for the specific service you would like. So the ones that I outlined earlier in our individual services, many of those have intake forms where you can complete it. So once you submit the intake form, you'll receive an email confirmation with the link to actually schedule your appointment. Again, and if you don't know where to start or what type of appointment you need, you can always start by making a health promotion appointment. And this appointment type really allows students to figure out and explore what services they might need to access and related to that health concern that they might have. And so the QR code is listed there for in order to make an appointment. So then just wrapping up with some key takeaways. If you remember nothing else, Alice is your one-stop shop for your health and well-being needs. If you aren't sure where to go, our team is the best place for you to go to get connected. We can get you connected across campus, get connected to other Columbia Health departments. So we do a lot of that resource and care navigation for students. We offer support in a variety of ways related to a range of health and well-being topics. And we really aim to work to support students both their individual well-being and community well-being at large. So if you have any questions, please don't hesitate to reach out to us at alice@columbia.edu. So with that, I will turn it back over to Gail.
Thank you, Padma. That was great. And if you all have been following the chat there, I have reposted some of the links if you wanted to click through those and check out what Padma was talking about. Um, just here, keeping you here for another couple minutes to remind you that we do have a number of webinars coming up in this series, introducing you all to Columbia Health and the services that you have available to you as students. Next Wednesday in the evening, our Student Health Insurance Office is going to go over how Columbia Health works in partnership with your health insurance plan, whether it is the Columbia plan or your own insurance plan. That Friday, we have 3 providers from CPS, or Counseling and Psychological Services, talking about how they support your mental health and ways for you to actively manage your emotional well-being, so you can stay resilient throughout your time here. Then that following Thursday, we'll have one of our nurse practitioners from medical services talk about ways to take care of your physical health and how medical services can support you. Um, and last but not the least, just in time for Relationship Violence Awareness Month, our prevention coordinator from SVR will be talking about how to build strong relationships and help build a compassionate and accountable community here at Columbia. You can go to the next slide. Um, as Padma mentioned, we host a ton of events. But the easiest way for you to get to know what and when those are happening is by following us on Instagram. We also work with the Alice Health Promotion team to post health tips, relevant services that you might be thinking about. Also, when you can get your free flu shot. We are hosting a walk-in flu clinic at the end of October. Please watch your email, or if you follow us on Instagram, you'll be the first to know when we will be having those. It'll be 1 week at Lerner Hall. We can go to the next slide. And so if you are interested in any of the events that Padma was interested in, plus webinars on student health insurance, we are hosting an introductory one next week. However, there is a series that sort of takes you through additional levels of understanding of health insurance to make sure that you're maximizing your benefits. So do register for those as they come up, because they're really, really informational and really helps round out the healthcare that you receive while you're a student. And you can toggle to the next slide, and this is the last. Again, thank you all so much for being here today. This webinar series is something new for Columbia Health, so we would love to know what you thought about this format. If there's any information that you would like to hear, more of, less of, or any other format that you would prefer to have, please tell us. We'd love to know how to best reach you and your fellow students with the health and well-being services that are available to them. All right. And so with that, Padma, do we have any last words for our audience today?
Yeah, well, thank you all so much for being here. And, we know that this is well-being, your well-being is something that's going to be something that evolves over your time at Columbia. And so please know that we're always available for you, not just beyond this webinar, but also throughout your entire time at Columbia.